Hi, I'm Jim, N4BFR. It's Friday, July 14th, 2020. Let's take a look at your COVID-19 coronavirus update for Georgia. We've got some new metrics for you to take a look at. So here's today's report, and we're going to start with some positives today. I feel like we need something a little more uplifting. So, good news, we talked yesterday about the last 3 Fridays have been really bad for cases and for fatality reports. We did not see that today. So, not as bad as the last 3 Fridays, I guess can be called good news. Looking specifically at the deaths, we had reported over 80 last Friday, and it was down to 35 this week. So, better. Below 7-day average, not where we want it to be, but we'll continue on with that and take that as it's got to start down sometime, so we'll take that as that. The other piece of good news that I want to say is taking a look at the active hospital beds. We dropped below 2,700 today. We actually had more than 100 beds free up, so that is a good sign, particularly when we didn't see the deaths go up, because that would unfortunately free up a bed. But what we saw was an improvement there of almost 100. So less pressure on the hospitals is good, and fewer deaths than we thought is good. While we're on the topic of the fatality data, though, I will say that the 35 that we had today, 35 reports, put us at 375 for the week, which ends Sunday. That already puts us over the last week's record, which beat the week before, So we are now in the 4th week of setting COVID-19 death records at 375, and we still have 2 more days to go. Now, we typically don't see as many on Saturday and Sunday, but we could end up over 400 for the week. I would not be surprised at that number. Okay, getting into the testing data. Testing was a little bit off from last week. We also saw cases off about average, but cases were in general off from last week as well, down 882. As I was looking at the weekly data for the deaths, I was looking at the weekly data for the testing and the cases. It's way lower than we've seen. It's probably as low as we've seen in more than a month when you look at those 2 data points. And they're closely correlated, right? You've got to have the tests to get the case counts. But if you don't have people feeling symptomatic, they're not going to test, and we won't get the case counts, unless you're in Paulding County, where a bunch of people are starting to say, well, we don't want our kids to look bad, so let's just keep them home from school and not test them for COVID-19, so then we won't have any negative reports, and our county will look better. I don't think that's the answer, but that's what people are discussing. So that is if you don't test, you don't know. Stick your head in the ground, and hopefully your kid doesn't turn into one of the worst case scenarios because you haven't watched out for them. Somebody's going to get that in a second, I'm sure. Hello? Yes, I have an old-fashioned phone with an old-fashioned bell, and I love it. Okay, back on topic here. So we talked about cases, we talked about Paulding County. Let me hit a little bit more on hospitalizations. New hospitalizations were down 20% from last week, but flat to the 7-day average. So that is coming down as well. We can see the trend there. The CCU percentage dropped to 85%, which is better than we've been seeing it. We also saw Region E Athens and Region H Oconee drop below the 90% threshold of utilization. That's good. We're just down to 5 at this point. I can pop those up, and there they are. So the 5 that are still above 90%, that's the Macon region, 16 beds left. Columbus region has 9 beds left. The Shoreline has 20. The Albany area has 6. Tift region has 4, and the Kennestone area has 17. They did add a couple of beds today. Didn't print out the school list today, but you can go ahead and check it out when you get a chance in the spreadsheet. There were 17 incidents, 19 cases, 54 quarantines, but a lot of unknowns where it came to we had student or students report, those kind of things. A lot of the other reports today are about high school football getting either canceled or postponed. So there's I incorporated that data in there as well because that's generally been done because there have been cases, although there were really no cases to be reported in that information. And I also put some info in on the Paulding County stuff. So still seeing schools in Cherokee have cases every day. There's some sort of report, so we added a couple of those today. And we'll keep watching that data. It's becoming harder and harder to keep up with. If you do see something and can share it in one of my Reddit posts, that would be terrific. That will help me find it. So if you want to see that data kept up, kind of help me keep up with getting that information. All right, so that's the daily updates and stuff. I want to touch real quick on a story that came up this afternoon by the Atlanta Journal-Constitution. The headline was, Georgia keeps key virus information from public. And I thought I wanted to include it here, partially because if you didn't read anything else, you may say, well, they're keeping counts down. They're not telling everybody everything they want to know. And that doesn't appear to be the case. And we looked at, earlier this week, we looked at the death reports and the pneumonia reports, and we got into all of that. What this is it is public records requests made by members of the public, newspapers, whatever, to get information regarding how the state has reacted to these things. The AJC has requested that the Georgia Emergency Management Agency give them information on the pandemic. I did a bit of a short write-up in the article I posted on Reddit. Too long, didn't read write-up, but basically the AJC said, hey, GMA, tell us how you're distributing PPE. How are you distributing the stuff you're getting from the federal government? What's the share like? How is that going? What GMA sent back was basically a spreadsheet that was completely redacted. So if you've ever looked at the malicious compliance subreddit, you'll know exactly what happened there. AJC went to the state attorney general, said, hey, listen, this is not in the spirit or the order of the law. The AG said, well, here are the rules around releasing stuff. And they were marked official use, which is not confidential. But the AG's office would not clearly say, hey, we're not sharing these because they were X, Y, or Z as they're required to do so. So there is, at least from the opinion of the AJC, there is some sandbagging going on here, which is not surprising when you put it in context of the fact that the AJC and others have also said, hey, Georgia Department of Public Health, we want communications. We want back information regarding how things are going in your department. And what they have said is, well, we're under an executive order for the pandemic, and we're not going to share any data for at least 30 days until the emergency order is out of service. Even though the AJC at this point has paid almost $3,000 to get that data. So it's unfortunate that as a state, we're not getting what we're paying for, which is accountability. I think we should all be asking for that because we pay our taxes, and I'm not one of these guys that says, hey, Mr. Policeman, dude, I pay your taxes, don't do that. But it is reasonable to say you could find somebody at Department of Public Health, you could hire a temp, you could do other things to get this data for the public if you wanted it out. Even if you didn't want it out, you could find somebody to do this. So this is sandbagging in my mind. It appears that it goes all the way to the top to Governor Kemp based on previous articles I've read. So we're going to have to continue to see what happens, but I do think that We need to continue to ask for accountability. There may be a special session coming up, and maybe there's an opportunity in that to get more accountability and see what we can do. So get ready to talk to your state reps and state senators as those things start to come into play. All right, off my soapbox for the day. I don't think I have much else for today. Tomorrow is Saturday, so probably a little bit lighter on the data as we just kind of check out what's happening over the weekend. And then Sunday will be the big weekly recap, and we'll see what other records we set in Georgia this week. Have a nice night, nice morning, whatever the case may be, and we will see you tomorrow.